Herpes simplex virus 1, or HSV1 for short, is a virus that is part of the herpes virus family. This virus is commonly responsible for cold sores and fever blisters. In this visual mnemonic video, I'll cover everything you need to know about HSV1 so that you're ready for test day. The rest of the Simpsons family is out tonight, so Grandpa Simpson is babysitting little Maggie. Doesn't she look adorable in her Simpson onesie? These Simpsons are our recurring symbol for simplex, like in herpes simplex virus. Get it? Simpsons for simplex? Then, this Simpsons onesie is our topic anchor for herpes simplex virus 1, or HSV1, since the 1 in onesie should make you think of the number 1. Now that we've anchored ourselves to this virus, let's discuss some of its important characteristics. Check out this toy harp that Grandpa Simpson bought for Maggie. He must love to shower his grandkids with gifts when he visits. Speaking of, this harp is our recurring symbol for herpes viruses, since harp sounds like herpes viruses. As its name suggests, herpes simplex virus 1 is a member of the herpes virus family. We have a dedicated video on herpes viruses, but to give you a quick recap, herpes viruses are a group of DNA viruses that also include the Epstein-Barr and varicella-zoster viruses. Let's move on to the clinical presentation on HSV1. Grandpa Simpson really wanted to keep the harp protected on his way to the Simpsons' house. That's why he packaged it in bubble wrap. This bubble wrap is our symbol for vesicular rash, since a vesicular rash refers to a group of blisters or bubbles on the skin. Specifically, HSV1 presents with a characteristic cluster of vesicles on an erythematous base. These vesicles can ulcerate, progressing to postulations, ulcers, and scabbing. Any direct contact with these infected lesions can transmit the virus. Now, let's move on to discussing the progression of an HSV1 infection. Turn back to Maggie here. As the baby of the family, Maggie is our symbol for a primary HSV1 infection, because primary means first, just like how being a baby comes first in life, right? During a primary infection, HSV1 replicates at the initial site of exposure. Yum! Maggie's eating spaghetti and tomato sauce for dinner. Babies are always so messy. She got the red tomato sauce all over her mouth. This red sauce on her mouth can help you remember gingivostomatitis, a mouth infection with gum swelling and ulcers. A primary HSV1 infection can manifest as gingivostomatitis, referring to oral ulcers, fever, and swelling in the cervical lymph nodes. This condition most commonly occurs in young children. Of course, Maggie's also eating with her hands. That's why she has red sauce all over her fingers. This red sauce on her fingers is our symbol for herpetic whitlow, since the red sauce kind of resembles these finger ulcers. Herpetic whitlow is generally caused by touching infected lesions with the hand. This leads to a primary HSV1 infection of the finger. I want to note here, a fact that test writers love is that herpetic whitlow is often seen in dentists, since these people occupationally use their hands to touch a lot of mouths, which often can have oral herpes or gingivostomatitis. Should make sense, right? Okay, now that we've covered a primary HSV1 infection, let's move on to another stage of this virus. After dinner, it'll be an early bedtime for Maggie. Take a look at her crib. Above it, there's a baby sensor so Grandpa Simpson can keep an eye on her throughout the night. This crib is our symbol for dormancy since it's where a baby sleeps. Then, the baby sensor above it can help you remember that HSV1 establishes dormancy in sensory ganglia. Get it? Baby sensor for sensory ganglia? HSV1 enters sensory neurons after a primary infection of the mouth or genitals. The virus then travels via retrograde transport to the sensory ganglia. Like other herpes viruses, HSV1 can maintain a lifelong latent infection in the sensory ganglia. During this period, its viral genome is maintained, but no viral progeny is produced. Now let's turn our attention back to Grandpa Simpson. As a grandfather, he's much older than Maggie. That's why this older Simpson is our symbol for HSV1 reactivation. Because reactivation comes after a primary infection. Just like being old comes after being young, right? HSV1 reactivation is actually very common. During this period, the virus replicates in the sensory ganglia and travels via anterograde transport to reach the epithelial cells. Remember that bubble wrap we talked about earlier, when I said that HSV1 presents with a cluster of vesicles on an erythematous base? Well, this bubble wrap can similarly help you remember herpes labialis, or clustered vesicles around the mouth and nose. These lesions are colloquially known as cold sores or fever blisters. Since we've already covered this presentation of HSV1 above, let's move on. Where did Grandpa Simpson buy the toy harp? That's right, it was from his local Target store. You can tell from his empty bag with a Target logo on it. This Target bag here should help you remember target-shaped lesions. You see, another skin manifestation of HSV1 is erythema multiforme, which is characterized by target-shaped lesions. In fact, HSV1 is the most common trigger for this skin condition. Okay, we've now covered some of the main symptoms of HSV1. While these are usually mild, there's actually another group that experiences much more severe symptoms of this virus. Let's move on to our next symbol to discuss this further. Since Grandpa Simpson is getting older, he uses a cane to help him get around. This cane is our recurring symbol for immunocompromised individuals. Get it? Since being immunocompromised means you have a weak immune system, and canes help people with weak legs, right? We're talking about immunocompromised individuals because HSV1 can have very severe effects for this group. Check out the cap that Grandpa Simpson is wearing. It's a bright red flat cap, the perfect style for an older gentleman. By the way, this red cap is our recurring symbol for encephalitis, because the red caps kind of make his head look inflamed, right? In immunocompromised individuals, HSV1 can invade the central nervous system, causing encephalitis. This can be particularly damaging to the temporal lobe, leading to fever, seizures, altered mental status, and focal neurological deficits. Since Grandpa Simpson is much older, he doesn't drive anymore. Instead, he decided to take the train to the Simpsons' house. You can even see the punched-out train ticket in his coat pocket. This punched-out train ticket is our symbol for an esophagus with punched-out lesions, because the long train ticket kind of looks like the long tube of the esophagus, right? You see, HSV1 can cause esophagitis, an inflammation of the esophagus. This can develop into punched-out ulcers along the esophagus, causing difficult and painful swallowing. Esophagitis is especially common in patients with AIDS. I want to specifically note the punched-out appearance of these ulcers on endoscopy. You see, esophagitis caused by other infectious organisms like CMV tends to present differently. For example, CMV causes linear or long ulcers in the esophagus that run down lengthwise. In contrast, HSV1 here causes hole punch or round ulcers to be visible. This is a pretty important distinguishing fact, so be sure to remember it. Now that we've covered the clinical presentation of HSV1, let's move on to its diagnosis. Turn to this note on the bubble wrap here. You know how many manufacturers, or all manufacturers in general, sometimes leave little thank you notes to thank you for supporting them? Well, this thank you note, or should I say, zank you note, is here to thank Grandpa for supporting the toy harp company. By the way, the zank you note is our symbol for a zank smear. In this test, epithelial cells are scraped from an infected lesion and prepared on a right Giemsa stain. The zank smear is not used often in clinical practice due to its low sensitivity and specificity. However, it is still extremely high yield for the exam. So just think of this thank you note for the zank smear, okay? On the thank you note, the manufacturer also drew a goofy picture, a cow with giant googly eyes. These eyes kind of remind you of cells, right? That's why these giant round eyes are our symbol for giant cells. What's more, the irises of these googly eyes kind of look like intranuclear inclusions. Pulling it together, an HSV1 zank smear may show giant multinuclear cells with intranuclear inclusions. These intranuclear inclusions are basically the visual appearance of HSV1 replicating in the nucleus of the infected cells. Pretty cool, huh? Let's move on to our next symbol to learn more. Speaking of, this cow on the Zanku note here can help you remember the name of Cowdry bodies. Get it? A cow for Cowdry bodies? Specifically, an HSV1 zank smear may show Cowdry type A bodies. The intranuclear inclusion bodies I just described above are actually formally called Cowdry bodies. Alright, we're almost done. Before we do a quick recap, let's learn about one treatment for active HSV1 infections. Remember the Target bag that Grandpa Simpson had? Well, rather than just throwing it away, he decided to recycle it. This recycling bin here is our symbol for acyclovir. Get it? Recycling for acyclovir? Acyclovir, along with its related drugs, famciclovir and valacyclovir, are antiviral drugs used to treat HSV-1 infections. We have a dedicated video on acyclovir, but for a quick recap, acyclovir works by inhibiting viral DNA polymerase, preventing the virus from replicating. This drug is the first-line therapy for all active HSV infections, but it unfortunately does not have any impact on the dormant or latent form of the virus. As such, acyclovir can be used to treat active cases, but the infection really never permanently goes away. Alright, that's it for HSV-1. Let's do a quick recap before we go. The Herpes Simplex virus 1, or HSV-1 for short, is a member of the herpes virus family. HSV-1 presents with a vesicular rash often around the mouth and genitals. Contact with these infected lesions can transmit the virus. HSV-1 clinically presents in 3 main stages. The first is a primary infection, when the virus actively replicates at the initial infection site. In children, this can manifest as gingivostomatitis, a mouth infection with painful oral lesions. If the virus initially infects the fingers, it can cause herpetic whitlow. As a primary infection of epithelial cells, HSV-1 enters sensory neurons and establishes dormancy in sensory ganglia. Here, HSV-1 can maintain a lifelong latent infection. Reactivation of HSV-1 is very common. This can manifest as herpes labialis, which is colloquially termed cold sores or fever blisters. HSV-1 can also lead to target-shaped lesions on the skin, known as erythema multiforme. In immunocompromised patients, the effects of HSV-1 are much more severe. An HSV-1 infection can lead to a temporal lobe encephalitis. It can also cause esophagitis, with painful, punched-out ulcers along the esophagus. An HSV-1 infection can be diagnosed with a Zenk smear. The smear shows giant multinucleated cells that have intranuclear inclusions known as Cowdrey bodies. Finally, antiviral drugs like acyclovir, famciclovir, and valacyclovir are the main treatment for active HSV-1 infections. Alright, we're actually done. After that messy dinner, I think it's little Maggie's bedtime. Let's leave Grandpa Simpson to babysitting and get out of here. I'll see you in the next one.